Alright, so this is your diabetes crash course. We're going to talk about diabetes mellitus, high blood sugar, low blood sugar, and then DKA versus HHS. Type 1 diabetes. These are your insulin-dependent friends. Autoimmune, they cannot produce their own insulin, so they must be treated with insulin. Type 2, this is what you do. So we're going to start with diet and exercise, then we'll move to oral meds. Insulin's going to be our absolute last resort because their body should still be able to make insulin. Then, of course, we know gestational, which is during pregnancy. So know your insulins and your oral anti-diabetics as far as signs and symptoms. That's on your MedSurge ATI page 489. Can also be found in your ATI Farm book as well. So hyperglycemia, high blood sugar. We're going to be seeing things like the 3 Ps, polyphagia, polyuria, polydipsia. We need to know about our diabetic foot care. They need to look at their feet every day. They need to wash their feet every day. They need to test the water with their arms or a thermometer, and they should not soak their feet. They should pat their feet dry, especially between the toes. They can use lotion as long as it's not between the toes. They may want to use a foot powder to keep their feet from sweating. They're going to want to see a podiatrist, and they're not going to want to wear open-toed shoes. They can cut their own toenails, but they want to do straight across and typically when they're wet. They want to wear clean socks and do not use any kind of heating pad on your feet. We have our diabetic retinopathy, our diabetic neuropathy, and our diabetic nephropathy. All of this is going to be damage to the organs, either the eyes, the nerves, or the kidneys due to vascular damage. So retinopathy, we can't see. We want to make sure that they get frequent eye exams. With the neuropathy, they can get that numbness and tingling. They can lose sensation. That's why they have to have such good foot care. And then we can also have nephropathy, which is going to affect our kidneys. So we want to make sure we're monitoring INO, BUN, creatinine, all of that good stuff. And make sure they're drinking plenty of water. Okay. Then we have our hypoglycemia. Cold and clammy, they need candy. Things that they're going to need to look out for. They can have things like headache, confusion, fatigue, tachycardia, sweatiness, nervousness, shaking. Hypo versus hyperglycemia is going to be on page 490 of your MedSurge book and the ATI book. So as far as exercise goes, we want to exercise when glucose is between 80 and 250, and we do not want to exercise if there are ketones in the urine. We want to make sure that we eat before we exercise, a nice carbohydrated snack first. And we want to make sure we're wearing comfortable shoes, wearing an identification band, and we want to check our glucose frequently. We want to look at illness. This can cause hypoglycemia. We want to continue to take our hypoglycemic agents as needed or as prescribed. We want to meet the normal amount of carbohydrates that we usually get. And if we can't get that, we can consume liquids for that. We want to make sure that we are monitoring for ketones during that time, monitoring for fever, any kind of disorientation, confusion, rapid breathing, nausea, vomiting, diarrhea. And if we can't eat, we may need to change the amount of insulin that we're getting. Okay. And now we have DKA versus HHS. So DKA and HHS are both caused by hyperglycemia. DKA is usually greater than 250 and can go up to 800. HHS usually starts at over 600. Okay. So similarities. We're going to have our 3 Ps, polyphagia, polyuria, polydipsia. That's going to be the same just because of our high blood glucose. We can have weight loss because the cells cannot use their glucose because of insulin deficiency. The body's placed in a catabolic state, so they can lose weight during this time. We can have nausea, vomiting, and GI pain, blurry vision, headache, weakness, orthostatic hypotension, and mental status change. The things that are different, remember, I teach y'all to focus on what's different, not what's the same. In DKA, you have that acetone breath because of ketones that are being produced, so you're going to have ketones in the urine. You will not have ketones in HHS. You're going to have that Kurzweil respirations in DKA because that's the body's way of trying to correct the acidosis that you're also going to get. In HHS, you may have seizures and paralysis. That paralysis is reversible, but it can happen with HHS and it won't happen with DKA. So just remember the things that are different.